Hello, my name is Jose,
Hello, Jose.
and I'm going to be your nurse today.
Okay, thank you.
What is your name?
Yolanda Pereira.
What is your name of your date of birth?
28th of July, 1948.
Do you have any allergies?
No.
I'm going to wash my hands and I'm going to don gloves. Can you tell me where you're at right now?
Yes, I'm in the hospital.
Can you tell me what year it is?
Yes, 2020.
Can you tell me who the president is?
Yes, Donald Trump.
So my patient is awake and oriented ×4. I have already assessed the patient's vital signs. Her blood pressure is 120/80. Her pulse oximetry is at 98%. Her heart rate is 60. Her respirations are at 16 per minute. And her temperature is 37.1 Celsius. Yolanda, do you have any pain?
Yes, right here.
The patient is pointing out at her upper left quadrant. Can you describe the pain?
Yes, it's a problem when I breathe.
Does it radiate?
No.
Does anything make it better or worse?
Yes, when I move.
And from a 0 to 10, 0 being no pain at all and 10 being the most pain, how would you rate your pain?
It's a 3.
When was the last time you had anything for food?
Lunchtime,
When was your last bowel movement?
early in the morning.
The patient looks well kept, she's calm, and her demeanor is fine. Okay, I'm gonna check your ears.
Okay.
So I start checking her ears. I'm looking for any drainage or anything out of the ordinary. Everything looks good. Do you use a hearing aid?
No.
Okay, so we're gonna do the whisper test. So I'm gonna conduct a whisper test to test your cranial nerve 8.
Okay.
I'm gonna include one ear. What did I say?
1, 2, 3.
I'm gonna include the other ear.
4, 5, 6.
Cranial nerve 8 is working perfect. I'm gonna check your mouth. Your lips look good. The color is fine. It's reddish, pinkish. It's fine. Can you please open your mouth? Close your mouth. Open your mouth again. Can you stick your tongue out? Can you move it up, down, sideways? Perfect. Can you close your mouth? Can you smile at me? Okay, great. So cranial nerves 9, 10, and 12 are intact, and the patient shows perfect symmetry with a smile and her face all around. I'm gonna palpate your lymph nodes. I'm checking for any swelling, any tenderness, anything out of the ordinary. Everything seems fine. I'm gonna assess the neck for JVD. The patient's neck, the skin looks good. There's no scars. The color is perfect. There's no JVD, no distension. I'm also going to auscultate for the carotid arteries, looking for bruit, and I'm going to use the bell for that. Okay, everything is fine. There is no bruit. Now I'm going to palpate the carotid pulses one at a time and comparing them with the radial pulse. And everything is fine. Can you close your eyes for me, please? Can you smell this?
Yes.
You can open your eyes now. What is it?
Coffee.
Okay, so cranial nerve number 1, olfactory, is intact. Okay, we're gonna do the vision exam now.
Okay.
Do you wear any glasses?
No.
Have you ever had any kind of eye surgery or corrective surgery?
No.
Okay, and we did the Snellen chart before, and the patient has 20/20 vision. Okay, now we're gonna assess for PERLA, which is pupil equals round reactive to light and accommodation. We're gonna use the pen light to check on the patient. Her pupils are fine. So the cranial nerve 3 is okay. Now the cardinal field of gaze, and also please follow the pen light with your eyes. Only your eyes. We'll go slowly. And the patient reacts well to the light. Cranial nerves 3, 4, and 6 are intact. Now test for the facial nerve. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this?
Yes.
Can you smile for me, please? Okay, her smile is fine. She shows perfect symmetry. So cranial nerve number 7 is intact. Okay, we're gonna test for the trapezius muscle. Can you shrug for me? Perfect. So cranial nerve number 11 is intact. Okay, so I'm gonna inspect her thoracic cage for symmetry, muscle development and configuration. Everything looks good. Her skin looks good. The color, her turgor, everything is fine. I can confirm symmetric respiratory expansions, warmth. There are no scars. There are no lesions. Everything is fine. Okay, now we're gonna check for muscle strength and joint range of motion. So I'm gonna ask you to please move this hand up, down, flex, extend. This arm is fine. Let's go for the next one. Up, down, flex, extend, away and back. Everything is fine. Can you please hold both arms and please put some strength on them. I'm gonna try and push down. Perfect. The patient shows good strength. The arms are symmetrical. The skin on her arms looks good. It's pink. There's no regular turgor, and everything looks good. Okay, I'm gonna check for capillary refill. It's fine. There is no clubbing. And both hands look good. Can you please sit down? We're gonna assess your deep tendon reflexes. We're gonna start with the brachioradialis. Then we're gonna do the bicep. Over here. And now we're gonna do the tricep. Please just let your arm hang. Perfect. The next one. Just let your arm hang loose. Great. We're also gonna do the patellar. Perfect. Okay. Now we're gonna do the Romberg's test. So I'm gonna please ask you to stand up. Thank you so much. Facing me. Please close your eyes and extend your arms. Okay, you can put your arms down and open your eyes. Please walk towards me and walk back. Perfect. Her gait is fine. The Romberg's test is fine. You can sit down. Her sway was natural. Everything is normal. Okay, now I'm gonna auscultate for heart sounds using the diaphragm. The first point is gonna be called aortic. Is the aortic valve is second intercostal on the right sternal border, where S2 is greater than S1. The second point is called pulmonic valve. It's on the second intercostal left sternal border, where S2 is greater than S1. The third point is called Erb's point, and it's on the third intercostal on the left sternal side, where S2 is equal to S1. We can use the bell for that one. The fourth point is called tricuspid valve, and it's on the fourth intercostal left sternum side, where S1 is greater than S2. And the last point is called mitral valve. It's also on the fifth intercostal on the left sternum border, where S1 is greater than S2. In order to do the apical pulse, I'm gonna ask the person to lean forward, and I'm gonna auscultate for a full minute. Okay, we're gonna do your abdomen checkup.
Okay.
And so the first thing I want to ask is, what about the last time you had a bowel movement?
Well, it was today in the morning.
What's the last thing that you ate, or when?
The lunchtime.
Okay. Also, what about your stool? Was it normal?
Yes, very normal.
Composition normal?
Normal too.
Okay. What about your bladder? Any problems?
No,
And no problems urinating?
no,
Everything is fine?
everything's fine.
Okay, I'm gonna inspect your abdomen first. And I can see that her skin is fine. There's no discoloration, no scarring, no lesions. Everything looks good. So we're gonna auscultate the abdomen. So we start in the right lower quadrant. We move to the right upper quadrant. Then we move to the left upper quadrant. And we finish in the left lower quadrant. Then we're gonna percuss. And everything is fine, it all looks good. We're gonna start palpating. First a deep palpation. We start in the right lower quadrant. We move to the right upper quadrant. We skip the left upper quadrant because that's where her pain is, and then we go into the left lower quadrant, and then we go at the end into the left upper quadrant. Everything seems to be fine. We also check the light palpation, same way. First the right lower quadrant, then the right upper quadrant, and then the left lower quadrant, and then at the end where her problem is, which is the left upper quadrant. We also can palpate, I can auscultate in the middle for bruit. And I confirm that there is no bruit. We can say that her abdomen in the upper left quadrant is soft and tender, and that's where her pain is. Okay, now we're gonna check your lower extremities. So we're gonna bend his knee, and then move outwards. Bend the knee, and move outwards. That is fine. I can check that the skin integrity is fine. I don't see any lesions, any scars. I'm checking for warmth. There's no sign of DVT, nothing out of the ordinary in her legs. I'm gonna check for the refill in her toes. It's fine. I'm gonna check her pulses, dorsalis pedis, popliteal, and her pulses are fine. Yolanda, thank you so much for coming today to the hospital. I hope your pain goes away very soon.
Bye-bye. Thank you very much.
You're welcome.